Question 1. A lone rescuer finds an unresponsive adult victim. After ensuring the scene is safe, what is the next critical step? A. Begin chest compressions immediately. B. Open the airway and deliver 2 breaths. C. Check for a pulse and breathing simultaneously. D. Retrieve an automated external defibrillator, AED. Answer: C. Check for a pulse and breathing simultaneously. This question tests the initial assessment steps for an unresponsive adult. After ensuring scene safety, the most immediate next action is to quickly check for signs of life, specifically a pulse and normal breathing, within 5 to 10 seconds. This simultaneous check helps determine if the victim is in cardiac arrest and if CPR or just rescue breaths are needed, guiding the next steps in the chain of survival. For example, if there is a pulse but no breathing, only rescue breaths are given. This critical assessment directs the appropriate life-saving interventions. Question 2. A 6-month-old infant is unresponsive and not breathing. A single rescuer finds no pulse. What is the correct compression depth for this infant? A. At least 1 inch 2.5 centimeters. B. Approximately 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 2.4 inches 6 centimeters. Answer: B. Approximately 1.5 inches 4 centimeters. This question focuses on the precise compression depth for infant CPR, a critical component of high-quality CPR. For infants, the chest compression depth should be approximately 1.5 inches 4 centimeters, or about 1/3 the depth of the chest. This depth ensures effective circulation without causing injury, as too shallow compressions are ineffective and too deep can be harmful. Always aim for the correct depth and allow for full chest recoil to maximize blood flow during CPR. Question 3. A lone rescuer witnesses an adult suddenly collapse. The victim is unresponsive and not breathing. What should the rescuer do first? A. Begin chest compressions. B. Activate the emergency response system. C. Deliver 2 rescue breaths. D. Check for a pulse. Answer: B. Activate the emergency response system. This question highlights the critical call first versus compress first scenario in the chain of survival. When a lone rescuer witnesses an adult suddenly collapse, it suggests a likely cardiac event, so the priority is to immediately activate the emergency response system, call 911/EMS, and retrieve an AED, as early defibrillation is crucial for adults. This is different from unwitnessed collapse or pediatric cases where CPR is often initiated first. Remember, for a witnessed adult collapse, getting professional help and an AED quickly is paramount. Question 4. When placing AED pads on an adult victim, where should they generally be applied to ensure effective defibrillation? A. 1 pad on the upper arm, 1 on the thigh. B. 1 pad below the right collarbone, 1 on the lower left side of the chest. C. Both pads on the left side of the chest, 1 above and 1 below the nipple. D. 1 pad on the center of the chest, 1 on the upper back. Answer: B. 1 pad below the right collarbone, 1 on the lower left side of the chest. This question assesses knowledge of correct AED pad placement for adults, which is essential for effective defibrillation. The standard adult pad placement involves placing 1 pad below the right collarbone, upper right chest, and the other pad on the lower left side of the chest, just below the armpit, ensuring the current passes through the heart. Incorrect pad placement can reduce the effectiveness of the shock, potentially wasting critical time. Always ensure good skin contact and avoid placing pads over pacemakers or medication patches. Question 5. A conscious adult is choking and making high-pitched sounds but can still cough. What is the appropriate action to take? A. Administer back blows and abdominal thrusts immediately. B. Perform chest compressions. C. Encourage the victim to keep coughing. D. Deliver 2 rescue breaths. Answer: C. Encourage the victim to keep coughing. This question tests the initial response to a conscious choking adult who still has an effective cough. If a conscious victim can cough forcefully or make sounds, it indicates a partial airway obstruction, and their own efforts are often the most effective way to clear it. Interfering with an effective cough can actually worsen the situation by pushing the object further down. Only when the cough becomes ineffective, e.g., weak cough, no sound, turning blue, should you intervene with abdominal thrusts. Question 6. What is the correct compression to ventilation ratio for a single rescuer performing CPR on an infant? A. 30 compressions to 2 breaths. B. 15 compressions to 2 breaths. C. 30 compressions to 1 breath. D. 15 compressions to 1 breath. Answer: A. 30 compressions to 2 breaths. This question focuses on the specific compression to ventilation ratio for single rescuer infant CPR, a key difference from two rescuer infant CPR. For a lone rescuer providing CPR to an infant, the ratio remains 30 compressions to 2 breaths, similar to adult and child CPR. This ratio ensures sufficient blood flow through compressions while providing necessary oxygen through ventilations. Maintaining the correct ratio is vital for maximizing the effectiveness of CPR. Question 7. Which action describes allowing full chest recoil during CPR? A. Leaning on the chest between compressions. B. Letting the chest come back to its normal position after each compression. C. Allowing only partial chest decompression to maintain pressure. D. Pressing more forcefully during the upward motion of the compression. Answer: B. Letting the chest come back to its normal position after each compression. This question addresses the crucial concept of full chest recoil, a cornerstone of high-quality CPR. Full chest recoil means allowing the chest to completely return to its original position after each compression. This action is vital because it allows the heart to refill with blood between compressions, maximizing blood flow to the brain and other vital organs. Leaning on the chest prevents this essential refilling and reduces the effectiveness of compressions. Question 8. When performing a pulse check on an unresponsive adult, which artery should you check? A. Radial artery. B. Femoral artery. C. Carotid artery. D. Brachial artery. Answer: C. Carotid artery. This question tests knowledge of the correct pulse check location for an adult, a critical step in assessing an unresponsive victim. For adults, the carotid artery in the neck is the most reliable pulse to check, as it is a large artery close to the heart and often palpable even with low blood pressure. The radial pulse, wrist, is generally too faint in a critical situation, and the femoral, groin, is less accessible. Always check for no more than 10 seconds to avoid delays in starting CPR if needed. Question 9. You hear a person on the ground making gasping sounds, similar to a fish out of water. What does this indicate? A. Normal breathing. B. Agonal breathing, which is not effective breathing. C. Obstructed airway, requiring abdominal thrusts. D. Panic attack, requiring reassurance. Answer: B. Agonal breathing, which is not effective breathing. This question describes agonal breathing, a common but misleading sign that is often mistaken for effective breathing. Agonal breathing is characterized by gasping, snorting, or gurgling sounds, but it is not effective breathing and indicates cardiac arrest. Recognizing agonal breathing is critical because it means the victim needs immediate CPR, not just monitoring or reassurance. If you encounter someone with agonal breathing, treat it as no breathing and begin compressions immediately. Question 10. What is the recommended compression depth for a child, ages 1 year to puberty? A. At least 1 inch 2.5 centimeters. B. Approximately 1.5 inches 4 centimeters. C. At least 2 inches 5 centimeters. D. Approximately 2.4 inches 6 centimeters. Answer: C. At least 2 inches 5 centimeters. This question specifies the correct compression depth for a child, an important detail in pediatric CPR. For a child, the compression depth should be at least 2 inches 5 centimeters or about 1/3 the depth of the chest. This depth ensures effective blood circulation to vital organs during CPR. Just like with adults and infants, ensuring proper depth and full chest recoil are key components of high-quality CPR for children. Question 11. An AED delivers an electrical shock. Immediately after the shock is delivered, what is the next action a rescuer should take? A. Check for a pulse and breathing. B. Analyze the heart rhythm again. C. Resume chest compressions immediately. D. Reposition the AED pads. Answer: C. Resume chest compressions immediately. This question tests the immediate action following an AED shock, a common point of hesitation or error. After an AED delivers a shock, the most critical action is to immediately resume chest compressions without delay, even if the victim appears to respond. Interruptions in CPR should be minimized to maximize blood flow, and continuous compressions are vital whether or not the shock was successful in restoring a normal rhythm. Do not check for a pulse or rhythm immediately after a shock. Question 12. A victim who is unresponsive and has slow, shallow breathing, with pinpoint pupils, is suspected of having an opioid-associated life-threatening emergency. What medication, if available and trained to administer, might be given? A. Aspirin. B. Epinephrine. C. Naloxone. D. Insulin. Answer: C. Naloxone. This question addresses a specific type of emergency, an opioid-associated overdose, and the appropriate medication. Naloxone is a medication that can temporarily reverse the effects of opioid overdose, particularly respiratory depression. Recognizing the signs, such as unresponsiveness, slow breathing, and pinpoint pupils, is crucial for timely administration of naloxone if it's available and the rescuer is trained to use it. Even with naloxone administration, activating EMS and continuing CPR as needed remains critical. Question 13. During a multi-rescuer CPR scenario, which statement best describes the role of the compressor? A. The compressor should also manage the airway and ventilations. B. The compressor should switch roles with the ventilations provider every 5 cycles or 2 minutes. C. The compressor should call out the number of compressions and monitor the time. D. The compressor should pause frequently to assess the victim's pulse. Answer: B. The compressor should switch roles with the ventilations provider every 5 cycles or 2 minutes. This question focuses on effective team dynamics during multi-rescuer CPR, emphasizing the importance of minimizing fatigue. The compressor should switch roles with another rescuer, typically the one providing ventilations, approximately every 5 cycles of CPR or every 2 minutes, whichever comes first. This regular rotation helps prevent rescuer fatigue, which can lead to a decrease in the quality of chest compressions. Maintaining high-quality compressions is paramount for victim survival. Question 14. An unresponsive adult victim is breathing normally and has a pulse. What position should the victim be placed in while waiting for EMS? A. Supine, lying on back, with legs elevated. B. Prone, lying on stomach, with head to the side. C. Recovery position, on side, with airway open. D. Sitting upright. Answer: C. Recovery position, on side, with airway open. This question tests knowledge of the recovery position, which is used for unresponsive victims who are breathing normally and have a pulse. Placing the victim in the recovery position, on their side, helps maintain an open airway by allowing fluids, like vomit or blood, to drain from the mouth, preventing aspiration into the lungs. Keeping the victim on their back could lead to airway obstruction if they vomit. Always ensure the airway remains open when using this position. Question 15. A child is conscious and choking, but then becomes unresponsive. After laying the child down, what is the next immediate action? A. Open the airway and look for the obstructing object. B. Begin chest compressions. C. Deliver 2 rescue breaths. D. Activate the emergency response system. Answer: B. Begin chest compressions. This question describes a conscious choking child who becomes unresponsive, a scenario requiring immediate CPR. When a choking victim becomes unresponsive, the standard approach shifts from abdominal thrusts to CPR, starting with chest compressions. The compressions help dislodge the object, and you should look for the object in the mouth before attempting rescue breaths. Starting compressions immediately is critical to maintaining circulation. Question 16. For an adult with an advanced airway, e.g., endotracheal tube, in place, how should ventilations be delivered during CPR? A. Deliver 2 breaths after every 30 compressions. B. Deliver 1 breath every 6 seconds without pausing compressions. C. Deliver 1 breath every 10 to 12 seconds with pauses for compressions. D. Deliver breaths only when compressions are paused for pulse checks. Answer: B. Deliver 1 breath every 6 seconds without pausing compressions. This question addresses CPR modifications when an advanced airway is in place, which simplifies ventilation timing. When an advanced airway is present, chest compressions can be continuous at a rate of 100 to 120 per minute, and ventilations are delivered independently at a rate of 1 breath every 6 seconds, or 10 breaths per minute. This change eliminates the need to pause compressions for breaths, improving the quality of CPR by maximizing continuous blood flow. Question 17. What is the preferred site for checking a pulse on an unresponsive infant? A. Carotid artery in the neck. B. Radial artery in the wrist. C. Brachial artery in the upper arm. D. Femoral artery in the groin. Answer: C. Brachial artery in the upper arm. This question focuses on the appropriate pulse check location for infants, which differs from adults and children. For infants, the brachial artery, located on the inside of the upper arm between the elbow and shoulder, is the most accessible and reliable site to check for a pulse. The carotid artery is difficult to palpate accurately in infants due to their short necks. Always take no more than 10 seconds to check for a pulse to avoid delaying CPR if needed. Question 18. When giving rescue breaths to an adult, how much air should be delivered for each breath? A. Enough to cause the chest to rise noticeably over 1 second. B. A large, deep breath to fully inflate the lungs. C. Just a small puff of air to prevent overinflation. D. Enough air to cause the stomach to rise. Answer: A. Enough to cause the chest to rise noticeably over 1 second. This question details the correct technique for delivering rescue breaths, emphasizing the visual cue for effective ventilation. Each rescue breath should be delivered over approximately 1 second, with just enough air to cause the victim's chest to visibly rise. Giving too much air or breathing too quickly can force air into the stomach, potentially causing vomiting and aspiration, which is very dangerous. Always ensure you see the chest rise and fall. Question 19. A rescuer has been performing high-quality CPR on an adult victim for 20 minutes without any signs of life returning, and no advanced medical personnel have arrived. When is it appropriate to stop CPR? A. after 30 minutes of continuous CPR, regardless of situation. B. Only when an AED tells you to stop. C. When signs of life return or advanced medical personnel take over. D. When the rescuer is too exhausted to continue. Answer: C. When signs of life return or advanced medical personnel take over. This question addresses the critical guidelines for when to terminate CPR. CPR should generally be continued until one of the stop conditions is met: S. Spontaneous circulation returns, signs of life; T. Transfer of care to more advanced personnel; O. Obvious signs of death, e.g., rigor mortis; or P. Physician, or designated healthcare provider, states to stop. Rescuer exhaustion is also a valid reason to stop, especially in a lone rescuer scenario, as poor quality CPR is ineffective. Question 20. What is the recommended rate for chest compressions for all age groups, adults, children, and infants? A. 60 to 80 compressions per minute. B. 80 to 100 compressions per minute. C. 100 to 120 compressions per minute. D. 120 to 140 compressions per minute. Answer: C. 100 to 120 compressions per minute. This question tests knowledge of the universal compression rate for all age groups, a key standard in BLS. The recommended rate for chest compressions for adults, children, and infants is consistently 100 to 120 compressions per minute. Maintaining this rate is crucial for providing effective blood flow to vital organs. Think of the beat to the song "Stayin' Alive" to help remember the correct pace. Question 21. For two rescuers performing CPR on an infant, what is the correct compression to ventilation ratio? A. 30 compressions to 2 breaths. B. 15 compressions to 2 breaths. C. 30 compressions to 1 breath. D. 15 compressions to 1 breath. Answer: B. 15 compressions to 2 breaths. This question highlights the specific compression to ventilation ratio for two rescuer infant CPR, a common point of confusion. When two rescuers are present for an infant, the ratio changes to 15 compressions to 2 breaths. This increased frequency of breaths is due to infants and children often having respiratory-related cardiac arrest, making ventilations more critical. Remember, the ratio differs from single rescuer infant CPR and adult/child CPR. Question 22. You find an unresponsive person. After assessing the scene for safety and determining the person is unresponsive, what are the universal next steps regardless of age? A. Immediately begin chest compressions. B. Check for a pulse and breathing simultaneously. C. Activate the emergency response system. D. Open the airway and give 2 breaths. Answer: B. Check for a pulse and breathing simultaneously. This question focuses on the consistent initial assessment steps for any unresponsive victim after ensuring safety. Once unresponsiveness is confirmed, the immediate next universal step is to check for a pulse and normal breathing simultaneously for no more than 10 seconds. This quick assessment determines if CPR is needed and guides the subsequent actions, such as activating EMS or starting compressions. This systematic approach ensures appropriate and timely care. Question 23. An adult victim has a visible medical device, possibly a pacemaker or implanted defibrillator, on their upper chest. When using an AED, how should the pads be placed? A. Place both pads directly over the device. B. Avoid placing pads directly over the device. C. Place one pad on the abdomen and one on the chest. D. Do not use the AED, wait for EMS. Answer: B. Avoid placing pads directly over the device. This question addresses a common special consideration for AED use: the presence of an implanted medical device. When an AED is needed on a victim with a pacemaker or implanted defibrillator, it is crucial to avoid placing the AED pads directly over the device. Placing pads over the device could block the energy delivery or damage the device. Simply adjust the pad placement slightly to avoid the device while still ensuring the current can effectively cross the heart. Question 24. A lone rescuer finds an unresponsive adult victim. After checking for a pulse and breathing, and finding none, what is the correct sequence of actions? A. Give 2 breaths, then begin 30 compressions. B. Begin 30 compressions, then give 2 breaths. C. Call 911, then begin 30 compressions. D. Apply AED pads, then shock if advised. Answer: B. Begin 30 compressions, then give 2 breaths. This question tests the compress-first approach for unwitnessed adult cardiac arrest by a lone rescuer. If a lone rescuer discovers an unresponsive adult who is not breathing and has no pulse, the immediate action after activating EMS, if not already done, is to begin chest compressions. The sequence for CPR is always CAB: compressions, airway, breaths. Starting with compressions minimizes delays in providing vital blood flow to the brain and heart. Question 25. During CPR, what does it mean to allow for complete chest recoil? A. The rescuer should lean on the chest slightly between compressions. B. The chest should return to its original position after each compression. C. The compressions should be delivered without interruption. D. The chest should rebound above its normal position. Answer: B. The chest should return to its original position after each compression. This question reinforces the critical concept of complete chest recoil during CPR, which is often misunderstood or overlooked. Complete chest recoil means allowing the chest to fully return to its original, neutral position after each compression. This full rebound allows the heart to adequately refill with blood, ensuring maximum blood flow to the brain and heart during the next compression. Failing to allow for complete recoil significantly reduces the effectiveness of CPR.